Hi, I'm Angela. Thanks for finding me on Monarch Mending. Today I want to take you through a sequence for tight neck muscles. This is the sternocleidomastoid muscle, the ones that come almost like a V, connecting here, back here. This one right here. These get really tight when you are constantly bent over somebody. I want to teach you how to loosen these up. The fascia gets stuck. It's almost like cling wrap, and it limits the motion. It pulls the muscles down of the face. So you can see it shortens the space here, and it also tightens into your chest. So this whole complex here just gets shortened. So we want to lengthen and make more space.
All right, let's get started. You're going to turn your head to find the SCM muscle. Sometimes looking down is helpful here too. You're going to pick it up down by your clavicle and lightly pull it away from your neck. So it should feel like a little rope or cable inside there, and you're kind of pinching around it and rolling it. And we're just going to work our way up from the clavicle back towards the ear, very slowly, very gently. This can sometimes feel a little uncomfortable, but if you're doing it slowly and gently, it should feel like a little bit of relief. And you can see that I'm working my way up, just rolling that between my fingers, being very careful. And sometimes I have to turn my head again. I've lost the SCM between my fingers and I just need to pick it back up. That's totally normal, especially if they're very tight. And what you will notice when you go to the other side here in a minute is that the sides, they're different from each other. So one side might be a little more challenging. And right here, I'm just vibrating the muscle a little bit. This helps to get lymph moving, blood flowing, create a little bit of space. And now I am smoothing out. I'm going to go to the other side here, turning my head to the side to pick up the SCM muscle down at the clavicle. This side's tighter for me, so you're going to see me lose grip several times. But that's okay. We just pick up and keep going. Pinching and rolling, pulling away slightly from the neck. Just working my way up. Taking some deep breaths as I do this, because this side's a little more uncomfortable for me. So some deep breathing here helps to tell the nervous system that it doesn't need to overreact in this situation. Small little wiggles, and now smoothing it out. Going to go back to the other side, and now we're going to do more of a static pull and stretching upwards. So I'm grabbing it just like I did before, and I'm holding it without wiggling it, and then I'm just moving my chin upward and a little bit of in a diagonal direction. I'm going to move up the neck, and I'm going to do it again. I'm going to hold, and I'm going to lean my head back. This can be pretty intense if it's tight, if you're just starting out here. Have I known these techniques for years? Yes. Have I just started doing this a month ago? Also, yes. I say this because as estheticians, we have a plethora of techniques that we can use and we tell people about, but sometimes we don't always take care of ourselves. So don't be hard on yourself. Just start whenever you've got time. So now I'm coming over to this other side and doing the same thing. Just a static stretch here. No wiggling. This is my tighter side. Really getting into that tough spot in there. And you can feel underneath that SCM on the tight side where it's just almost like glued in there. So just keep trying. If you feel like you can't really grab too much, that's okay. The longer you work at this, the easier it becomes and the less tight this muscle becomes. And like I said earlier, this affects all the way down into your chest and all the way up into your jaw. Tough stuff. All right, we are moving on to the platysma. And what I'm doing here is I'm just lightly pressing down, trapping it under my fingers and giving it a stretch by tilting my head back, chin to the ceiling, and think about giving yourself a little bit of an underbite here as your chin pokes out. The platysma is a muscle, a thin sheet of muscle that originates from the fascia in the chest and pectoralis and shoulders deltoid. So it reaches deep and wide, and it connects underneath the mandible closer to your lips. So that's why I'm opening and closing my mouth here. And from the side, you'll see me do it again. Thinking about my chin coming out like an underbite and opening and closing. It's going to feel tight. And if you don't feel like a baby pterodactyl being fed by its mama while you're doing this, then you are not doing it right. So when you have a tight SCM, it also affects your jaw muscles. I just want to give a little bit of loosening up into the jaw and the mandible, giving a little stretch here. I'm holding my skin up top and raking my knuckles down the sides of the muscles here. I don't need to spend a long time on it, but this helps to complete the stretch that we've started with the rolling of the SCM. And coming to the other side, holding and raking down with the side of my finger. This isn't supposed to be painful, but it should feel like something's happening. Sometimes when I'm in traffic, I lean my arm against the window and do this. These are great exercises to do if you're stuck in traffic. Maybe you'll inspire your car neighbors to help themselves too. If you find a little tight spot there, just wiggle it. A little bit of vibration. All right, getting everything back into place. Should feel a little bit looser, like you have a little more space. Thanks so much.